Donnell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. After spending a week in Washington, D.C., working on Capitol Hill last week, very tiring but very fulfilling meetings. We had several face to face. And then, because of the offices still being locked down for COVID, we had Zoom calls, lots of Zoom calls. We'd like to thank Dicerus Law for allowing our staff to use their beautiful uh, conference room. So it gave us an opportunity to have very professional meetings in a professional settings with our several congressmen and senators. Very interesting atmosphere in Washington, D.C. In order to eat in a restaurant, you must show your vaccination card and your ID, of course. So things, maybe that's how you operate in your state or city, wasn't something that most of us were used to. By the end, I guess we got kind of used to, having our mask, showing our vaccination, and showing our ID to get into every restaurant. But we had a lot of great conversation, and the first topic I want to talk to you about is the Navigator program. HAFA is asking that those on Capitol Hill ask the accounting office to do a report on actually how much the Navigator program is costing the American people. Simply navigators divided by policies divided by $80 million. What does that program look like? Back in 2016, when CMS did a report, it was $5,000 per policy. For agents and brokers, it was $2 and some change on average was what we got paid versus $5,000 per policy for a navigator to enroll a policy. With $80 million more than ever being put into that program, we're asking for some transparency. Of course, the Hill hasn't had any problem with asking us to adhere to transparency, and we have done it. We have done exactly what we were told to do, and we are adhering to the law thanks to Dicerus Law and HAFA creating the computer program to make sure that you're transparent. However, the Navigator program, there are no numbers currently coming out of Washington about what that program looks like. And we're asking for that information. The other thing is we'd like to ask you as HAFA members, what would you like to know about the Navigator programs? Maybe that could be included in the ask. Are navigators licensed in your state? Are they registered in your state? Are they background checked in your state? Are they fingerprinted? What are some of the ask of the agent community that we could include in this one ask for the GAO report? I will remind some of you that have known me for a while know that at the beginning of the ACA in Louisiana, I was working for another association and trying to pass navigator licensing bills. And one of the fights that was one of the groups that was fighting against me was the fact that they wanted to use prisoners as a way to rehabilitate them by having them enroll folks into the federal market in Louisiana. And I kept saying, you're going to give folks proprietary information. You cannot do that. Agents are licensed. We have E&O if we make a mistake. We're very highly educated. You cannot allow someone of that caliber to compare to an agent or broker. So what do we know about the Navigator programs in each respective states? We don't know. And absolutely not comparing to anyone that is using prison programs, but I really don't know. I don't know what each respective state does, nor do I know what their requirements are, and that might be something that we'd like to know. But the main thing that HAFA would like to know was, How much is it costing per policy for a navigator to enroll in the marketplace? And remember that we know navigator programs take the dollar amount, it trickles down into the premium. The user fee that the insurance companies pay to sell in the marketplace, part of that is used for the navigator program, which means the user fee trickles down to the premium, which means that our clients, the American people, pay more for their insurance policies to offset the user fee, which therefore pays the navigator program. How is that $80 million spent? Big question, big issue. The other thing we discussed was the COVID testing. With the fact that all plans must pay for COVID testing, whether at a doctor, over the counter, especially in the self-insured market, the employers are seeing a huge uptick in their claims dollars. It's astronomical in some instances. So our question was, is there any programs that can go to the insurance companies or employers by the folks that create these tests to bring those claims costs down? And in many cases, those tests are minimum $103 a piece. So if you have a huge large employer and someone is getting, several tests as, their right to do, then the cost is really getting up there. So that was something that we discussed. The other thing we talked about was the No Surprises Act, the balanced billing issue. That was fascinating. What we heard from the folks on the Hill, that the majority of the people that are visiting with them are the doctor sector. Not really hearing a lot from the insurance sector. We do know that AMA is suing. We know that there are a lot of things happening. It just went into effect, so I think they're still trying to figure out how it actually works. But something very interesting that we talked about, and think about this. If you're given a preliminary bill, which is required on both sides, doctors and insurance companies, but the doctor gives you a preliminary bill of $10,000 for your surgery. And he gets in to do the surgery and he finds 3 or 4 other things, and the bill ends up being $30,000. Is that $10,000 preliminary bill a contract? If it's a contract, does that doctor only get paid $10,000 and lose on $20,000? I think these are some of the things that they're trying to figure out, doctors are trying to figure out, insurance companies are trying to figure out, attorneys are trying to figure out exactly how that works. So stay tuned, more information. What I continuously said on the Hill was that, as insurance agents, our issue is that we want to make sure that the client is held harmless. So if I go to the right doctor, the right hospital, then I should not be penalized if an anesthesiologist puts me to sleep that's not in the network. It's not my fault. I did everything I could have done or I could have known. I didn't know what anesthesiologist was working on that specific day. If someone would have said, the anesthesiologist in your network is working on Tuesdays, I'd have had my surgery on a Tuesday. So stay tuned for that. It's going to be very, very, very interesting how that's going to play out. Commission transparency, that is in effect. We still do not have the CMS final rules. Couldn't figure out when that was being done. We did have several on the Hill saying that they would ask CMS to give them a report when that should happen. And why that is so important is because in the proposed rules, it says insurance companies may ask us to do their job of talking about the individual and short-term medical commissions. United Healthcare, in true form, has already sent out a memo saying it is our job. It is not our job at this moment. The law says that it is their responsibility. The insurance company must. Now, because it's in the proposed rules, it's probably going to be in the final rules. Remember, insurance companies have more money, more lobbyists, more attorneys than we ever dreamed of having. They just do. They have more clout than we do. But we're not going to stop fighting. We talked about it. We do not feel it's our job. We are doing the group part. We're doing the best that we can. We've created a computer program for HAFA members. It's only $75 for the year 2022. You want to make sure that you sign up. If you need the HAFA promo code, you just need to reach out. You must be a member of HAFA to get the special $75 discount. So, important things: the navigator transparency, the cost of the COVID test, the no surprise act, and the commission transparency piece. Now, everybody always says, "Hey, Ronell, what can I do? What can I do to help?" Well, while in Washington, I got a text that I'm going to tell you exactly what you can do. And we have to act before this that I'm going to talk about is the norm. It says, "Thank you for your partnership in driving a tremendous open enrollment for Oscar this year. We are thrilled to welcome our new and renewing members and continue to make a healthier life accessible and affordable for all. In light of our historic growth means they made more money. We are making several changes to ensure we continue to deliver high-level service and experience that our members have come to expect from us." Now, they made more money, they're going to provide better service, but how are they going to do it? They're going to get rid of you. Listen. For new individual and family plan initiated effective 4/1 or after, we will be reducing our broker compensation to, wait for it, zero, nada, zero. They are going to provide better services by getting rid of you, by paying you zero. In all markets, excluding California and Colorado. Do they have more money, more something going on in those two states? I don't know. If Oscar is in your state and it's not California and it's not Colorado, those premiums were filed with commissions, and now they are pulling out commissions and keeping that commission as profit. It's not impacting the monthly commissions on the small group or Medicare Advantage. So, first of all, it should make you mad. It should make you very mad. But what do? Number one, you need to start collecting data, because this has already been reported to Washington while I was there. So I've already started the ball rolling. Have you received any information? If you have, send it to me. Are they only saying it's for SCP or anyone enrolled, which would mean what I'm reading, and I think it says new, which would be new, and it's underlined and bolded, new, which would mean SCP, or if you were enrolling someone new. Let me know. Have you gotten any letters? Have you received anything? Get it to me. The other thing is, what can you do? You need to scream it from the mountaintops. You need to write your local paper. You need to reach out to the news channels. You need to start doing some interviews. There are some of you out there that are constantly in the news and are always sending me things you're doing. Every one of you needs to start being an advocate for yourself and for our industry. I can only do so much. I can't be everywhere at all times. I'm one person. You can. Start talking about it. Start talking about the fact that you work hard and you deserve to be paid a fair wage. Period. ... It's not fair. It is not fair. If anyone can get a hold of how much Oscar has made, how much they're making, what, if they're public, what their stock prices are, if you can help me get all that information, I would appreciate it. Something needs to be done. You need to get loud. You need to get proud, and you need to help me. I don't care if you do not sell Oscar, nor is Oscar in your state. You need to let people know that it's not fair, and we're not waiting for the next insurance company to come and say they're going to pay zero. Fight for your industry. We can't afford to lose our industry. We've been working too hard. I've been doing this since I was 18 years old. I started at Pan American Life when I was 18 years old. I refuse to give up this industry. I refuse to give up my livelihood, and you must refuse too. Until next Monday, have a wonderful week. I'm proud and honored to represent the HAFA Freedom Fighters, the Ninja Warriors. Ronnell Nolan.